Hey guys, this is my video for week number 3. I work in a physical therapy / occupational therapy outpatient clinic, so I do a lot of these exercises with our patients on a daily basis. I will be doing all these exercises in an anatomical position, so hopefully it's a little easier for you to follow along. So for the first exercise I have will be for flexion and extension. So I'm going to use my elbows in this case. So flexion would be bending your elbow, just like this. So flexion. And then extension would be straightening. So you have flexion is bending, and extension is straightening, just like that. My next set is abduction and adduction. So this would be also called abduction, adduction. It helps clarify a little better. So abduction is bringing away from your body, just like this. And then adduction is bringing it towards your body. A good way I like to remember this one is adduction, you're adding to your body, and then so abduction would be moving away from your body. Just like that. So abduction, adduction. Okay? And then the next set of exercises are for protraction and retraction. So with this one, I like to use my shoulders as well. A lot of time when I have a patient that has a shoulder injury, we'll have them lying face up on a table, and they'll have their arms out. Here, I'll turn to the side, it's a little easier. They'll have their arms out, up above them, and they'll be pushing out. So they'll be protracting their shoulders. So they're pushing out, and then coming in. And out, and then coming back in. And then for retraction, it's just about the opposite. So they're retracting their shoulders, bringing them back. So a lot of time we'll do scap squeezes with patients. So I'll turn around here so you can kind of see that I have my arms here, and then we're retracting the shoulders and bringing it back. So retraction, just like that. Okay? And then for our next set of exercises, I'm going to show you some circumduction. So circumduction, I also like to kind of remember like making circles. So you have your arms out here, you can do counterclockwise or clockwise, just like this. A lot of time too with shoulder patients, we'll do something called a pendulum. We'll have the patient bend over like this, and we'll make small circles with their arms. Just like this, kind of helps loosen everything up. This is some circumduction. All right, and then the next exercise that I have is for rotation. So rotation is also a good exercise for your cervical spine or your lumbar spine. So in this case, I'll do my cervical spine. So I'll be rotating my neck. So I'm going from side to side. Okay. So that would be rotation. You can also do rotation lying on the ground for a lumbar rotation. I'll show you right here. Okay. So I'm laying down here, and you have your knees together, feet together, and then you're just dropping from side to side. This is called a lumbar rotation, or a lateral trunk rotation. And then this is my dog, Ripley. He likes to help sometimes. Okay, so there's that exercise. And then, sorry, let me fix this. And then the next one that I have would be for supination and pronation. So supination, I'm going to use my arms. So supination I like to think of as you're holding a bowl of soup. That's kind of what my teachers always told me back in high school. So you have supination, and then you have pronation, which is face down. So supination, face up, pronation, face down. Just like if you're laying on a table, I have you supination when you're lying down on your back, facing up towards the ceiling, or you have pronation when you're lying on your stomach. Okay? And then the next exercises that I have is going to be for dorsiflexion and plantar flexion. So I'm actually going to use my feet for this one. It's a little easier to see. So I'm going to angle this down a little bit. So for dorsiflexion and plantar flexion, so I have my foot here. So plantar flexion, I like to do, so plantar flexion is actually pointing your foot. So think of it as P&P, plantar flexion and pointing, and dorsiflexion is bringing your feet or your toes towards you. You have plantar flexion, pointing, and then dorsiflexion, bringing your feet towards you. Just like that. Right? So I hope this kind of helped clarify what some of these exercises are, and I hope it helps you in your future, help explain these to your future patients. Thank you. Bye.